One of the first times that I heard your name was, and I've heard it so many times now because you've definitely been trying to get the word out about total harm minimization. And I read an article that you wrote in the New York Times, published March 20th, which was very early on in the pandemic, and I thought, wow, this actually makes sense. And I wasn't hearing too many things that made sense that weren't propagating fear. So I paid attention to the article, and then I saw you again on Bill Maher and Fox News, and I believe you even addressed the US Senate. Is that correct?
I did.
Right. So I said, where is this doctor who's making all this sense? And I looked you up and I found out, you've got to be kidding me, he's right here in Connecticut. So that's when I reached out to you and asked you to meet with me. But I was hoping you could talk us through what exactly total harm minimization is and why you think that's the best approach and how you came to that conclusion so early on. You know, we still haven't really gotten our act together, so I'd really love to hear about what brought you to that conclusion. And
okay, well, first of all, thank you. I appreciate the interest in my point of view. The other thing I'll say is that if you take a public position, as you are doing, you will have detractors as well as supporters, and so you will find people who oppose everything I have to say, and you'll find people even saying that I should not be opining about the pandemic because I've not devoted my entire career to infectious disease or pandemic response. Now, I've conferred with people who have done exactly that. I have lots of colleagues, some of whom are world-leading experts specifically in pandemic response. So I've spoken routinely, for example, to Professor Michael Osterholm at the University of Minnesota, who's probably the nation's leading expert on pandemic response. I am not. I'm board certified in preventive medicine, public health, and I think what that gives me is the big picture. And that's why I weighed in. Obviously, I've got skin in the game. I've got 80-year-old parents. I've got kids. I live here. You know, I have all the same concerns everybody else has. But the advantage for me is, yes, I'm trained in infectious disease epidemiology. Yes, I'm trained in outbreak investigation. I'm formally trained in epidemiology in general. I've co-authored 5 editions of a leading epidemiology textbook, so relevant qualifications.
Yeah.
Took care of patients for 30 years, including patients with every imaginable infectious disease, have dealt with outbreaks. But I'm equally interested in social determinants of health, what poverty does to health, what unemployment does to health, what depression does to health, addiction, suicide, domestic violence. In public health, when we're not in the middle of a pandemic, we routinely identify what we refer to as the social determinants of health. So, you know, essentially your environment, what your daily life is like, as the leading predictor of health outcomes. And that doesn't go away in a pandemic. If anything, the pandemic amplifies those effects because everybody is anxious and stressed. And so the effects of your environment are amplified. And we've seen that, by the way, in Connecticut and in the United States, where communities that were disadvantaged before the pandemic have been hit much harder by the pandemic. So it occurred to me very, very early, well, this virus is going to hurt some of us, and we need to protect the people who are vulnerable. And it was very clear before we had any homegrown data. We had data coming out of China, we had data coming out of South Korea, and it was my job as a health journalist and a public health expert to be monitoring that. It was very clear, Ellie, that this is not a one-size-fits-all threat. Elderly people were at high risk of bad outcomes from this infection, and people with serious chronic illness were at high risk of bad outcomes. But young, healthy people were not. Data out of South Korea, which did 200,000 tests very early within a span of just days, showed that 98 to 99% of all COVID-19 infections were mild. Said, okay, we need to identify who's at high risk and protect them very meticulously, but I don't think we need to shut everything down, because if we shut everything down, we're going to be protecting people who don't need to be protected, and oh, by the way, causing massive unemployment, massive hardship, food insecurity, desperation, destitution, depression, and all the things that ensue, like increases in violence, domestic violence, child abuse, addiction, suicide. And in fact, we've seen all of that. All of that's been reported. So really, my differential aptitude at the beginning of all this was just a penchant to look at the big picture, not to just look in one extreme direction or the other, but to say, this virus can hurt some of us. The way we interrupt transmission could potentially hurt more people than it helps. You know, when I was a kid, one of the things my mom taught me, look both ways before crossing a busy street. Well, I just thought we ought to look both ways for potential harm before we cross a busy pandemic. We want to minimize the harms from the infection. We want to minimize the harms from what I called interdiction, the things we do to interrupt transmission. And if we can minimize the harms of both of those, we'll save the most people. We'll protect health the best. That's what I wanted to do, and I called that total harm minimization. And then the approach that I and colleagues recommended from very early on was vertical interdiction or risk stratified interdiction. So if you just, basically if you lock down everything everywhere for everybody, I called that horizontal interdiction. Just shut it all down. Right. You know, and you know, when the smoke clears, we'll see what the results are, but we'll just shut everything down. Thought, well, you know, that's kind of like open warfare. We're going to have a lot of casualties as a result of lobbing bombs in every direction. You know, essentially, we're going to be victims of friendly fire. The intentions are good, but we're going to hurt people. A more surgical strike, where we identify where do we need to intervene to protect people. So, you know, it seemed to me we could stratify people by risk and develop policies to match the level of protection with the level of risk.
So you were saying that the social factors that lead to, you know, health outcomes, bad health outcomes, are a critical part of what you looked at. Do you know how those have changed in Connecticut, how they've actually increased in Connecticut or nationwide, how they've gotten worse because of the lockdown and the situation that we're in? And why do you think we have excluded those from the public narrative?
Well, you know, there are lots of different ways to measure social determinants of health, because they include things like education. And, you know, one of the things on the table now is, what do we do with these kids? Because, you know, yeah, okay, we don't want our kids to get exposed to this virus, although we can talk about kids being at very low risk generally. But there's more and more published evidence now talking about the adverse effects of kids missing out on a year of education, because, you know, most parents are not qualified to do good homeschooling. Kids being harmed because of the lack of socialization during critical stages of their lives. So education is one of the social determinants of health, and it's being disrupted. But probably the easiest metric is unemployment and job loss. And we've had over 40 million people in the United States register as unemployed during the pandemic, so 40 million jobs lost. I did a webinar not too long ago with a colleague at Stanford University, an economist named Nick Bloom. And Professor Bloom cited evidence that if you lose your job around midlife, so sometime around age 40, and you lose it for an extended period of time, it takes a year to a year and a half off of your life expectancy. Yeah. Okay, so 40 million jobs lost in the United States, and yes, that burden has fallen hardest on the people who had the most financial insecurity to begin with, right? It's not white-collar executives who've been losing their jobs for the most part. It's people, blue-collar people who are working really hard, you know, working to make ends meet in the first place. That's where it's fallen the hardest. Communities of relative disadvantage, that's where the unemployment has hit the hardest. You know, people working as servers in restaurants have all been laid off, and on it goes. So 40 million jobs lost, and the estimates are that maybe about half of those will be for an extended period of time, if not permanent. Well, 20 million jobs lost times a year and a half shaved off life expectancy for each of those, that's 30 million person years of life lost, having nothing to do with the virus or infection and having everything to do with massive unemployment. It was one of the messages I had a hard time conveying early on, Ellie. I'm not an economist. I'm a public health physician. I'm a humanist. My mission has always been do everything possible to maximize years and lives and life in years. Dollars are very much beside the point to me. But the simple fact is people have to pay their bills. They have to put so-called bread on the table, right? So these things matter. And people who are struggling financially are struggling psychologically. That matters too. So I really was looking at the human toll of this. This is not a question of lives versus dollars. This is lives versus lives. So 30 million person years of life lost due to social determinants. We've had 150,000 deaths from the virus in this country, and the prevailing estimate is that on average people are losing 10 years of life when they die from the infection. I think that's probably excessive. I actually volunteered and worked in New York City in an emergency department in the Bronx, did several shifts there, so I saw this up close and personal. And most of the people that I saw severely ill with COVID and the people that I saw die of COVID were very elderly and very sick to begin with, mostly being brought in by ambulance from nursing homes. So I don't think they were likely to live another 10 years. I think many of them actually were prone to die of something else within this same year. But if we say 10 years times 150,000 people, that's 1.5 million years, person years of life lost. That's a big number, but it's 20 times smaller than the toll of unemployment, which brings us back to total harm minimization. We need to look in both directions. There are some people we need to carefully protect from exposure to this virus. Again, especially people in nursing homes, elderly people, people with chronic illness. But we also need to protect the rest of our society from the incredible damaging fallout of complete economic collapse. So that's where the social determinants come in.
Right, and as you said before, depression, anxiety, and all of those mental health implications of the lockdown, which come from the economic factors. Do you know what the statistics are on the increase of suicides in the United States since this? Do you have any?
The data have been racing to catch up with the pandemic from the start. As I said, we're 4 months to 6 months into this experience. Feels like lifetimes. But actually 4 to 6 months is a very short period of time to do major epidemiologic research. So no, I don't know. What I do know is that there have been reports in specific locations based on 911 calls, based on first responders, emergency department experiences, of spikes in suicides, twice the usual number, 3 times the usual number. So at this point, the data are sporadic, and I haven't seen a national total. I have seen national totals for tracking of domestic violence, and that has trended up significantly. I have seen national totals for child abuse. That's trended up significantly. People are basically forced to stay in their homes with their family for months, with their worry, with their anxiety, and that's led to some pretty bad situations. We've seen increases in violence around the country, violent crime. And suicide has trended up, but I don't know the specific magnitude of the increase nationally, because most of the data we have so far are from specific locations around the country.
That's one of my greatest concerns, is that we don't know the full extent of the damage the lockdown has caused
Absolutely.
Yet. We don't know.
And Ellie, there's something, one of the things I wrote about early on, and nobody really wanted to hear. And it takes courage to speak up during a pandemic, because again, everybody's anxious, and let's be honest about it. A pandemic is a horribly inconvenient thing. It really is. It's scary and it's really inconvenient. The best choice is not to have a pandemic.
Right.
But once you're in a pandemic, you only have difficult choices, and then you have to size up, okay, among the difficult choices, which is the best? But one of the things that concerned me is, as we were starting to really fixate on the pandemic and propagate fear and anxiety, so we were hearing every day about the toll of the pandemic, cases, and in particular deaths. And early on, we were starting to hear about, the aggregating number of deaths in the United States. And I was starting to see people around me, and around me meant physically around me, people I interacted with, but also my social network online. They were reacting to these numbers as if the sky was falling. And I thought, I wonder if these people realize, in a population of 330 million, that about 8,000 people die of miscellaneous causes every day. I don't know, maybe you didn't know that. In the United States, 8,000 people, give or take, die every day. Now that may sound tragic, But of course it's not. We're mortal. We're all going to die.
Right.
So most of the people who die of old age. Obviously some of those deaths every day are tragic. Mostly though, they're people who are old and people who've been sick for a while, and we're all going to die someday. So the population turns over every year, about 1%, just a little bit less. So close to 3 million people die in the United States every year. The numbers we were hearing about the pandemic seem to imply that COVID was the only thing killing anybody here, right? So if you were to fixate on every death every day from, say, heart disease, and about 1,800 people die just of heart disease every day in the United States, 1,800 people every day. So, if you were to focus on that and report every one of those deaths as national news, people would freak out. They'd say, oh my gosh, there's something in the drinking water. We were doing that for COVID. So, yes, a pandemic, it's new. You don't know how big the danger's going to be. It's really important to pay close attention to the data, but it's also really important to preserve context and not to distort the figures. So 150,000 people have died of COVID, but overwhelmingly, the death toll has been in older people, especially those over 80, but those over 70, and in people with serious chronic illness. Well, here's the thing. People who are old and have serious chronic illness are the very people prone to die without a pandemic.
Right.
And I think one of the things we don't know as we try to get a handle on the big picture is how many of the people contributing to the death toll from COVID are people who might have died of something else within the same year. And one of the things we'll see over time is whether, in fact, we had a compression of mortality. So people, all died at the same time during the pandemic, but for the remainder of the year, once we get through this, will mortality for the nation as a whole, for Connecticut as a state, actually go down? And I don't know those answers, but these are the right kind of questions to be asking if we really want to get a handle on where is the risk and for whom. So as you say, there really is a need to contextualize, and that requires looking at the big picture and recognizing that, okay, COVID is a threat we need to take seriously. It's not the only thing going on here.
Right. People need to have perspective, and I think we've really lost our perspective. This is Ellie Kousidis, and I approve this message.